everyone, and welcome to this evening's meeting of the Health and Wellbeing Board Community Subgroup. I think we're feeling a little bit of a sense of deja vu this time this year, so it'll be good to run through all things COVID again in the agenda. So the first item is apologies for absence. I've had apologies from Mohan. I don't believe there have been any additional apologies, but I'll look through to see any hands. No. And then minutes of the previous meeting. Can I just get agreement that those are a correct record? I see nods, so we're all good with that. And then just moving on to the next update, which is the COVID update from Dagmar, and I'm sure Dagmar will have a lot to tell us, so I'll hand straight over.
Hi, good evening. Really sorry for being slightly late. I struggled to actually come on. I hope you can hear me okay? Yeah, thumbs up? Yep. Okay, so very brief update. As you will be well aware, infections are rising. That is the case in London, that's the case in Merton. It's quite eye-watering numbers. So London, about 12,000 cases a day. That mirrors Merton creeping up from initially 100, 200, around 300 cases a day now. So large numbers. The main distribution is still younger people. We had lots of outbreaks in school-aged children. I think Councillor Stringer will be well aware. It's spilling over into the younger adults. We assume this is the people around the kids, so the parents. Hospitalizations, and Mark, we've got you there for the hottest up-to-date news, have been steady, and they are steady at the moment, possibly nudging up a little bit, but it is too early. We now know that hospitalizations lag behind the infection surges, so we need to be prepared. You will have heard, obviously Omicron is the mutant variant now that is becoming dominant. Nationally, the assumption is it's about 20%, but that was yesterday, so it's probably more today. In London, it was already yesterday 44%. So that is the reason why we're now not in a way chasing two pandemics, one of Delta and one of Omicron. We are now, you will have seen all the rules, etc., are aligned again. We're fighting COVID, and we're assuming it's Omicron. So possibly the most important message is obviously all for us to roll up our sleeves and support the rollout of the vaccination. That is still the most important measure to protect us as individuals, us as communities, the NHS as a service. And really important to say, it is obviously the booster which has made particular headlines, but I've just come from another meeting. Really, it's the dual approach. It is the evergreen offer, and underlying is we do not want to leave anybody behind. So that is quite an important message, to have that dual approach. So I just wanted to stop here. I'm delighted that actually the focus of this subgroup meeting is on vaccination equity, so that is really, really timely. I just wanted to give a word or two that we have got quite in-depth data, so that the data can guide our action. But at the moment, the data is not shareable with the public. And I just wanted to explain, it's really, really important that we use granular data, but it is evolving, as you can imagine. And we are obviously bound by data protection for individuals, as well as data sharing agreements between organizations. And you have heard and have seen data have been misused, that have been used to divide communities rather than bring them together, all of that is an underlying reason why data sharing agreements are quite tight. So for today, therefore, we will discuss the granular data and our activity in the closed session. But generally, we obviously attempting very much in the spirit of transparency to share as much as possible with as widely people as we can. That's all I want to say.
Thank you, Dagmar, and I appreciate some of the questions that we might want to ask might have to be answered in closed session. But can I ask if there are any questions to Dagmar on anything that she's presented? Or anyone else who wants to come in and comment on, I suppose, the experience, especially from vaccine, the NHS at all? I can't see any hands. I have just a couple of questions. I suppose the first one, we've heard quite a bit about the difficulty in getting lateral flow tests from the sort of national portal. Is there any detail on, from a local perspective, how you can access lateral flow tests? And then the second question is whether we have any details just for the public around any of the walk-ins for boosters or for vaccination across Merton or South West London.
Yeah, so absolutely, the LFT shortage was a temporary shortage for the online ordering. As I understand, that has already been rectified. We responded very promptly because we have got plenty of stock in Merton. It's available through libraries and through our community pharmacists. And we were supporting our primary care colleagues yesterday as well, because obviously for staff continuity, really important, because the policy has changed. You can do daily LFT use if you've been a close contact and then continue working. So we've been out and about, we've communicated to staff and, as I said, to our stakeholders. So my sense is, after that blip of concern and worry, it has calmed down, and everybody who needs an LFT is getting one. The other one was about walk-in for vaccination, and I might hand over to my colleagues in a minute. At the moment, I know that a lot of planning is already happening for ready dates for the Nelson and the Wilson. But shall I hand over to my primary care colleagues for more details?
I'm happy to just update if that's useful, and we do have Mohammed on the call as well, who's also on the operational leads at the Wilson, so can always add as well. But I just should say from a more, yeah.
Can I ask the chair so whether she will kindly let me come in before you come talk about the vaccines, just about general theme of this discussion. Chair, I think we also need to put it in perspective. Compared to this time last year, Chair, we need to make it very clear that we are in a far better place. I don't want hopelessness and helplessness and despair to creep into the minds of anyone. Vaccine aside, we are in a better place now. If you look at the therapeutics, it's far more advanced than ever before. So I would say that before we go into the vaccine discussion, so important it is that we really make it clear to everybody we meet that if you have the disease, if you develop the symptoms, please get tested, because testing will open the door for early intervention therapeutically. That wasn't there before. So I think we mustn't miss that narrative in our desire to talk about the vaccine. We mustn't forget the narrative that if you have symptoms, get tested for multiple reasons. Obviously, you can isolate and your people who we come in contact with can get tested early. But secondly, this new door is open for us in therapeutics. And I think we mustn't forget that part. Over to you, Kate. Sorry for interrupting you.
Thank you, Fasa. And I think actually just to reiterate, we have been here before when you said this feels like deja vu, but we have been here this time around with having been doing this for 12 months. So I think that's also to reiterate as well that we are in a better position because we have the site. So we have a team that are in place and are ready to mobilize because we haven't not been doing it. So I think despite us feeling like this is where we kind of were, we really are, and I see Mohammed in probably a better position in terms of where we are. In terms of what we're doing in terms of walk-in centre and walk-ins, both, and I think the Wilson is doing walk-ins at the moment, or from tomorrow, aren't you, Mohammed? And mobilising almost 7-day-a-week service across Merton and our local vaccination sites, which has been stood up at pace. And we are also offering extended hours from the morning in the Wilson till I think it's almost till 10 o'clock at night. So those kind of positions are up and running, and we have been able to put something on, as Mohammed will say, in a very, very, very short amount of time. So we have been mobilising and are currently vaccinating a huge number of people through the system, starting from today and going forward. I should also add on bank holiday weekends. So on the 27th and 28th, they will also be operating across Merton. So I think just to add that we have stood up a very rapid response to this in a very short space of time.
Thank you, Kate. Mark?
And just to add that I think actually we're quite lucky in Merton with our PCNs and the way that they've configured the service, because I do think at the moment other boroughs are struggling to get their PCN sites re-established, and actually the Wilson has just ramped it up really, and I think that's testament to our PCNs and our primary care colleagues that have really been able to switch it back on so quickly. So they're kind of slightly ahead of the ask in terms of some of the other boroughs. So I just wanted to congratulate them on that, even though it's very early days.
Thank you, Mark. Were there any other questions to Dagmar or to anyone else on the sort of COVID update? Can't see any other questions. I know that we'll later go into closed session on COVID update, but I suppose just to take this opportunity to say thank you again for sort of continued work around COVID and the vaccine drive, and again during sort of the festive period, appreciate the challenging time and also working around the clock as per last year. So it's very much appreciated on behalf of all Merton residents, I'm sure. And I think now we're just moving on to Barry, who will provide an update on post-COVID syndrome.
Thank you, Councillor Lanning. And as Dagmar's kind of touched on already, the focus of tonight's meeting is on vaccination. So there's not a significant agenda item on post-COVID syndrome, but work is progressing, and that's really important. The steering group is meeting on a regular basis. We're working through the numbers and the data, so to understand the prevalence of post-COVID, and then also the need, and then we can identify what we need to put in place to raise awareness and encourage people into the right pathways. So our intention is to come back to the next meeting with a more focus on post-COVID syndrome. But what I can update the community subgroup this evening on is that we've been going out and we have been raising awareness of post-COVID syndrome within our communities. So we had a well-recognised and well-received session at the Joint Consultative Committee with Ethnic Minorities, where our CLCH colleagues presented the overview of post-COVID syndrome, what it is, what the symptoms are, and how to access services. And that was kind of that starting point. And at that meeting, it was really helpful to get some views from around the table about how we can follow up on those individual communities to raise awareness and encourage uptake into the pathways. And then I also believe that VASA's got a session later on this evening after the Health and Wellbeing Board subgroup, which again, we've got a number of voluntary and community sector providers that are members of our BAME Voice organisation in Merton. So again, it's a bundled session with messages on vaccination. It's covering testing, it's covering the changes in the rules, but it's also covering, really importantly for us, post-COVID syndrome. So the work, Councillor Lanning and colleagues, is continuing. We're focusing on that equity as you asked us to do, but we're going to come back with a more detailed agenda item in our next meeting.
Thank you very much, Barry, for that overview. Are there any questions to Barry on the work that's ongoing? Vasa? Oh, Mark, sorry, I didn't know whether that was a legacy hand. Can I go to Mark first and then to Vasa?
Yeah, okay. So I just wanted to just add kind of from the services from a health perspective. So we're currently seeing about 25 referrals into the health post-COVID service, and that's probably slightly higher than we anticipated. And it's also that as we target sort of sectors of the community, underrepresented sectors, we are seeing those numbers increase, which is good from a service perspective, because it actually means we are drawing people into the service. We've got some continued national funding, and just to say that in the new year we will undertake a kind of peer review. But initial indications of that is that our service will compare quite favorably to others.
Thank you, Mark. Vasa?
Thanks, Councillor Annie. I think Barry is a good friend of mine because Barry does post-COVID. Barry also, don't forget, does pre-COVID. Pre-COVID is getting fit. And I think we mustn't, in the midst of this vaccination, we mustn't forget Barry has a pre-COVID role as well, which I hope in a few months' time, we go back to that, because we can't only meet and talk about COVID and post-COVID, because the pre-COVID bit is very important for survival of COVID and also of non-COVID diseases. So I'm not trying to spoil the party here about the vaccine, but I really want to bring it across that vaccine is good, but we also have to get our population fitter and healthier to survive these things, which I'm afraid are going to come our way. And we can't keep postponing the other agenda, Barry. So come the daffodils, we got to meet and talk about the pre-COVID. Give me time till the daffodils come out to deal with the vaccination and the booster and the flu, but we got a date.
Thank you, Vasa. And hopefully we cover that off more in the Health and Wellbeing Board as well. But yes, no, very important point. Thank you. Mark, did you want to come back in? No. Okay. I can't see any other hands for that item. So Barry, thank you very much for presenting. Look forward to looking at post-COVID syndrome in more detail at our next meeting. And now I think, somewhat reflecting on Vasa's last point, moving on to health on the high street, I think I am handing over to both Vasa and Barry on this item.
Thank you, Rebecca. So if I start, and again, a double act with my good friend Vasa. So thank you for joining us tonight. So health on the high street, we've spoken about the Health and Wellbeing Board, and we've discussed in a range of different, now different meetings. But this is really part of our local health and care plan in Merton. And it's our real desire to change how people can access health and care services, health and wellbeing services. So our plan is to pilot the feasibility of community health on the high street. So this is where we bring services together where they live their lives, which is on the high street, which is in those high footfall areas. But really, secondly, really importantly, it's how we develop the culture of integration. It's not just about services being under the same roof, it's how they work on a day-to-day basis. So our model, as we have spoken to a range of partners, listened to our communities as well, is twofold, and it's emerging as we go along. The first part of this is the importance of fixed sites. So what our plan is, what our model is that we will have a number of 7 fixed sites, which are our community libraries. Our community libraries in Merton are well resourced, they're great assets in the community, and they're well used. So we're going to turn our libraries into the front door to that prevention offer. There's going to be resources, there's going to be services, there's going to be digital tools to be able to support people to lead healthy lifestyles. And these will be on the high street in fixed sites on 24/7 basis. But we're going to enhance this, and we're going to supplement this with learning from the vaccination program with pop-up sites. And again, this gives us the opportunity to flex. So we can flex to different places, different settings. We can go to disused high street sites. We can go to community centre venues as well. And it gives us the real opportunity to bring services together in a flexible way. So as well as this, so we've got 7 fixed library sites, and we're looking at pop-ups as well. And we're really keen to connect with our primary care networks. So as place shapers, but also so we can link into those local health priorities there. But also the wider NHS development, so the diagnostic hub. So it gives us a range of different opportunities. So we've got 7 fixed sites and a range of pop-ups, which we're going to develop across the borough. We're getting a project manager, thank you, Mark, to lead the programme of Health on the High Street, but also do some other work on Unhealthy Place as well. And we're also really importantly looking at evaluation. So we're working with our colleagues in Kingston who have a similar approach to health in the high street, so that we can work on a National Institute for Health Research bid so that we can evaluate the impacts of health on the high street. So colleagues, we're in a good place. We've got a good model. And so it's really important that we kind of realise that in the new year. And like I say, linking into the PCNs. So maybe now I can hand over to Vasa just to give that PCN perspective, or Vasa's perspective, on the opportunity that health on the high street brings to primary care.
Thanks, Barry. For a long time, we have been talking about health on the high street, healthy high street. Now you see how it is connected, because you can't have a healthy high street unless you have health on the high street. So we are actually going to a place where we genuinely belong. We're not invading somebody else's territory. We are reclaiming the high street back for health. The second thing to remember is the concept of libraries, Barry. Libraries were originally established to have literacy for people who couldn't purchase their books, people who couldn't have a warm place with lighting to sit and read. Now we are going to the same place to talk about health literacy. Again, it's a mistake of me and my peers. We haven't used the word health literacy loud enough. And now we are going to proclaim this word, health literacy. And we're going to do whatever we can in the library to promote health literacy. Because unless you promote health literacy, you can't actually deal with the inequalities of health, which arise from the illiteracy. So I have no shame to say that the place in the library is our place. We are only getting it back from the councillors who run it. We are reclaiming that land back to as well for health, for the community advancement, because that's the rightful place for us. Then we come to the pop-ups. Pop-ups will be based on the need of the population, so that what is on offer is for what those people in that area really need. And that's bottom up. If they say they want to talk about dementia, we will talk about dementia. If they want to talk about diabetes, we will talk about diabetes. If they want to talk about teenage suicide, we'll talk about that too. Because as we have agreed with the two of us, there is no prohibition on any health and well-being topic. And that is the spirit we want to engage in this. It is a community asset, and the community will dictate to us what they want us to do there. And the PCMs, they are fighting among themselves. Everybody wants to be involved in this. So there's healthy competition in wanting to be in the community to talk about this topic. So it's exciting spring ahead of us.
Thank you both. Sounds like a really exciting initiative, and clearly a lot of work has gone into this since we heard about it at the Health and Wellbeing Board as well. So it's really great to hear. Are there any questions for Barry or Vasa on health on the high street? Just looking through. I know we had a comment from Mohan, which we'll just run through, and I think this reflects Vasa's comment on the PCN support. He's just said that it's a great opportunity to outreach into the community and use our existing assets to support our residents, and he's in full support. So I think we've had that sort of support across the board. I just wanted to ask a quick question in terms of how it would sort of work in practice. I appreciate that it will be accessed within libraries or community centres or pop-ups, but in terms of what it would look like for a person sort of walking into their library, what will the Health on the High Street offer actually be?
Thank you, Rebecca. So I guess it depends on the libraries. There's 7 libraries. We're looking for a universal offer, but it also be targeted as well. So the libraries have a range of wellbeing and pop-up sessions already taking place. So they're supportive environments where people can get support, advice and guidance. There's also some really innovative work on the digital side. So there's blood pressure monitors and a range of other kits that people can go to perhaps get their height and weight measured. And then they'll have the information on perhaps weight management services or substance misuse services there too. So that fixed offer is a drop-in. You can go and get the appropriate information. There's a really strong books on prescription type approach as well. So thinking about the self-care, self-management side of things. And then clearly we can signpost on to the other services that we have. So all kind of exciting stuff. We're working through some of that detail, but I think there's lots of really innovative work, particularly around that digital side, which is going to be really fantastic to kits in our libraries, where it could be brilliant for us.
Thanks, Barry. Could I bring in Mark and then Kalu and Vasa?
Barry, is it fair to say that one size doesn't fit all, though? So actually, you will see different services delivered from different sites based on the community around them, really, and what the needs are. So I think that's a really important point, really, is that we do need to look at the communities around and who uses the libraries to then tailor the services in them.
Thank you, Mark. Kalu and then Vasa.
Yeah, just off the back of what Mark had said, I wonder about the so there are some other projects which look to embed or have community-driven services, and just thinking about sort of needs, I wondered about community strengths. So those communities have skills and knowledge within them existing. There are organizations that are already trying to provide services, so the ways that they can be complemented or integrated, indeed. And one way I'd seen had been actually training people within communities themselves to actually work or have pathways to employment. I wonder if that's something that Vasa, I'm seeing nod, so it seems that that's something that you're already considering.
Okay. So thank you, Chair. What we are doing is we are stealing from the existing library. So all of us know when we were children, we go to the library, sometimes someone sits there and read a book for us. Sometimes the library gets an author to come there and talk about their book they have written. Similarly, we want to get guests in there so that people actually know this is a place where interesting, exciting things happen. So it can be a health app, it can be a consultant. If somebody says, I want to learn about HRT, for instance, it can be a gynecologist who comes in the evening or in the weekend to the library premises, so that people can come and see the experts, talk to the experts, ask the questions, rather than the barriers to access we have, where you got to see a GP, get a referral, see a consultant, etc. So this is really trying to bring the consultants into the library. We already bought consultants into Polaris Baptist Church. We've done it already. So we know the formula, and the consultants are willing to come into libraries too. So this is really connecting the citizen with the specialist at home, literally at the citizen's place rather than the consultant's place of residence. And it doesn't need to be consultants. It can be a dietitian, it can be a health visitor talking about looking after children, talking about breastfeeding, whatever the topic is, which is really grassroots developed. It's our job then within the health and social care sector to bring the experts there to meet the people, rather than do what we did in the past, tell people come to a place where we want to stay and we say you got to get here. Now we are saying we'll get there, and can you meet us please? And that is really exciting, and I really can't wait for this booster to finish and the flu jabs to be done and be done with this vaccine and start doing this type of work, which is really, really going to change people's lives.
Thank you, Vasa. Could I just build on the point that Kalu was making? I think because we also have a number of sort of voluntary sector partners who might be doing similar pieces of work as well across the community. And I just wondered, as part of the sort of design of what health on the high street would look like, to what extent we're able to sort of consult and bring those voluntary sector groups in to sort of design the service as well.
I think we absolutely must, Rebecca. I think it's really important for us. We've built those relationships over the last number of years. We've strengthened them over the last 18, 19 months. We're working really closely with some of those community organisations on our COVID response, but we're working with them on COVID response and COVID recovery. So again, this gives us one more opportunity for us to connect our services with the community and to listen to their needs as well. So yeah, we absolutely must. And so as soon as we get this project manager in post, we're able to enhance the outreach, the engagement, the communication, to really build on some real strong commitment to health on the high street, to really deliver strongly across Merton.
Thank you, Barry. Una?
Thank you. Yeah, thank you. I mean, I generally feel that this is, you know, an exciting project and one that I think we can all get behind. And it just strikes me that obviously there can be some places where there isn't a library and where there are parades of shops and that sort of thing. So presumably it's also looking at perhaps some of the shops where they may have closed, or you know, other opportunities, or perhaps there's a hall that's not in such good use, etc. I mean, I know many are, but equally there could be times when they're not. And so it's really sort of thinking outside the box a little bit as well. So obviously libraries are really important, but there's other community spaces. Councillor Langan just touched on some of the spaces as well, the voluntary sector, but of course there's also some of our faith organisations, and also in the theatres. Polka, for instance, comes to mind, or different sort of community groups as well that may have space of different types. So I think it's quite exciting to think about the different areas where this could be appropriate, and also looking at where not everyone does go to the library. I know a lot of my children went to the library to find somewhere quiet to work, actually, funnily enough, not just to get out a book, but to go and study, funnily enough. But there's also, so obviously that's quite good at the teenage level and so on, and not just the little children and older people, but obviously as well, some people just don't get out. So it's how we reach them again, isn't it? And where are they going, and where are people, where's the footfall of where people are going on the high street? That would be an interesting bit to see where we can catch them. But yeah, it's definitely a really good thing, I think.
Thank you, Councillor Moulton. And again, I've been told that within Merton, you're never 1 mile away from a library, but that's why we've really focused on two parts to the model: that fixed site plus also the pop-up site, so we can be flexible.
As I've said before, Barry, a mile can be a very long way. When Wimbledon Park Library got closed, that was one of the main reasons I became a councillor. It took me 20 years, but eventually we got a lift for Wimbledon Park. But we are pretty much, yes, as crow flies, a mile. But you try walking that mile, now, particularly if you've got a buggy or you've got a gammy leg or whatever it is. So, anyway.
I understand. But again, that's the benefit of the libraries model plus the pop-ups. We can respond to community needs, as kind of Mark's kind of touched on there, and very much linking to making, it's health on the high streets. We want to use our high street venues, but it gives us flexibility to work in those community centres across the borough if we need to as well.
Thank you, Barry. And we look forward to hearing more about how the sort of Health on the High Street initiative moves forward, especially when the project manager comes into place. So thank you again for bringing that to us. I think that brings us to the end of the public meeting before we move into the closed session on vaccination and equity. So I'll just take this moment to thank everyone for participating and watching in this session, but we will be closing the live stream and moving into the closed